Well, hello everyone and welcome in. I hope everyone is having a great day so far. Thank you for joining us for the first session of Clearwater's second annual AI Summer Series. My name is Monica Pastor. I serve as the Senior Events Marketing Manager here at Clearwater, and I will be your host for today's session. So over the next several weeks, this five-part series will explore one of the most significant challenges facing healthcare organizations today: how to safely, effectively, and responsibly adopt artificial intelligence while managing the risks that come with it. Today's session is titled, Whose Risk Is It Anyway? Building the AI Accountability Model. As AI adoption across the healthcare, organizations are facing a critical question: who owns AI risk? When an AI tool influences a clinical decision, impacts patient privacy, introduces a security vulnerability, or creates a compliance concern, accountability isn't always clear. Yet boards, regulators, patients, and executive leadership increasingly expect organizations to have answers. So that's exactly what we'll be covering today, and we're getting excited to get diving into that content. Before we begin, a few quick housekeeping items. All attendees are in listen-only mode and will remain on mute and off camera. Please submit your questions using the Q&A feature at any time during the presentation. We'll reserve time towards the end of the session for audience questions. A copy of today's slide deck and other relevant blogs and articles can be found in your Resources tab on your Zoom navigation bar. Towards the end of the session, an attendance certificate will also pop up that you can download for attending today. This webinar is being recorded and will be made available to all registrants following today's session. When we start the Q&A section towards the end, a brief survey poll will prompt up, and we'd really appreciate your quick feedback on what you found of value today so we can make sure to make these worth your time. Now it's my pleasure to introduce today's speakers. Our moderator, Chrissy Safi, serves as Senior Vice President of Consulting Services at Clearwater, where she works with healthcare organizations nationwide to strengthen cybersecurity compliance and enterprise risk management programs. She brings a unique perspective to today's discussion, particularly as healthcare organizations work to define ownership and accountability for AI-related risks. So welcome, Chrissy. Chrissy will be joined today by two accomplished healthcare leaders. Chris Cuellar is Vice President and Chief Compliance Officer at Elevate ENT Partners. Chris oversees compliance, privacy, and enterprise risk initiatives across a growing specialty healthcare organization and brings extensive experience in governance, regulatory strategy, and operational risk management. So welcome, Chris. And last but not least, Blaine Hebert is Vice President and CISO at Onvita Health. Blaine is a nationally recognized healthcare security leader who has long advocated for treating cyber risk as enterprise risk and is actively helping shape how AI governance evolves within healthcare organizations. So together, these leaders bring perspectives from compliance, security, governance, and executive leadership that will help us better understand what a practical AI accountability model looks like in healthcare today. So with that, I'm going to stop talking. I'm going to kick it over to our moderator. So Chrissy, the floor is yours. Thank you.
Wonderful. Thank you so much for the introductions and kickoff there, Monica. I look forward to speaking with you, Blaine and Chris. It's going to be a great conversation. So let me just start off with a little bit of setting the stage here. So what we see is that healthcare has officially crossed a threshold. AI is not sitting in labs anymore. It is showing up in clinical summaries, in documentation, decision support, patient communication, revenue cycle, and vendor platforms. The American Medical Association now reports that more than 80% of physicians use AI professionally. At the same time, AI tools are becoming more autonomous, which means accountability has to mature just as quickly. When we talk about the risk, so the risk is accumulating really between the seams between all these different functions. So compliance sees privacy, regulatory documentation, and billing risk, while security sees data exposure, shadow AI, access, vendor, model risk issues, and clinical leadership sees patient safety and workflow risk. But when something goes wrong, the organization needs one accountability model, not five parallel interpretations. So all of these things bring us to today's discussion and today's question around whose risk is it anyway? So I'd like to open this up for some questions for you both, and really dig into this and educate me, us, and all of our attendees here. So Chris, and then Blaine, I'd like for you guys to answer the next question here. So in your organizations right now, not on paper, but in practice, where does AI risk actually live?
Sure. I mean, it's a great question. I mean, I think it lives kind of everywhere that you want it to live, but it's going to be evolving and there's going to be new kind of places. In terms of accountability, it's a shared risk. The way we kind of structure it, our organization is, we want to have like an operational champion or a leader of every project, and then having, the different stakeholders, the different subject matter experts, myself, we have Cliff is our counterpart of Blaine, right? Our Chief Information Security Officer. So it lives throughout the organization, but it's going to impact everyone throughout the organization. So we need to kind of find a way to get people kind of on the same page, understanding both the great, opportunities that it presents, but also the risks, and being prepared for that.
Yeah, absolutely. Blaine, what are your thoughts on that? Where does AI risk actually live?
Well, I think it's dependent on what the organization or the direction that the organization wants to go to and where they want to levy that risk at, whether it's the CIO level or the executive leadership team. Um, so I think that's dependent on the way the organization wants to roll. Not all organizations have a chief risk officer or a chief AI officer, at least at this point in time. But for us, we promulgated an AI committee comprised of different people from across our enterprise, and we're getting ready to expand that to a larger footprint. But for the immediate, the first looks for AI responsibility lies upon myself, and the chief medical information officer is also a co-chair of our AI committee. All of that, since I'm a direct report to the CIO, 99% of that gets funneled up to the CIO, who's a member of the executive team. So he has the ability to escalate any concerns to the executive leadership, the senior vice presidents in our organization.
Okay. Yeah, very interesting. Thank you both. So we have these two seats at the table here, the CCO and the CISO. So let's dig in a little bit to kind of how those different roles play here. So Chris, I'm going to start with you. So where does your compliance mandate start and stop in the AI lifecycle? So is it procurement? Is it deployment, ongoing monitoring? Give us some insight there.
Sure. So a little bit of all, right? I mean,
Hmm.
definitely procurement, like I think of it, the way I look at it is kind of like beginning, during, and end, right? Procurement obviously is a big part of that. Like who do we want to have AI partnerships with? And kind of, on the business side, we want to leverage our scale. We have, physician practices in multiple states. So using those economies of scale to give better pricing, better client relationships, right? As we become a bigger client to our third-party vendors, right? We get kind of more, TLC, client service representation, things like that. So using that to kind of, but again, we want to be very strategic on who we align ourselves with.
Hmm.
I think, all our different markets, we have a physician that, has a friend, at a social event that tells them about this new AI scribe tool or something like that. And then we get reached out, at a corporate business office level, like we want to explore this. But that might not be, or we might be running in parallel three different projects for that same tool. So again, kind of using our governance, using kind of like our procurement process and rules and procedures, to kind of narrow it down to the best fit for our organization. So then, that's kind of like the beginning phase, like who do we want to partner with, who, we're going to kind of align ourselves with in terms of these AI enhancements and opportunities. But at the same time, you know, doing our due diligence through that process, talking about these risks on a proactive level. So once we partner with them, right, the contract, the ink has been signed, right? Now it's like we're committed to a certain amount of period. So we want to make sure we kind of, thought through in a thoughtful manner who we're aligning with. And then throughout the process, the ongoing monitoring, the one thing I think unique about AI is, you know, it's so different than it was 2 years ago today. and it's going to be so different 2 years from now. So talking about, what are going to be the new, kind of versions of the AI models, how it's going to kind of incorporate to kind of fit our growing demands as we continue to grow as an organization, and just kind of monitoring through the process. There's going to be issues, right, in the AI space. You hear about hallucinations, algorithmic bias amplification, kind of that black box problem where you don't know, you get an answer, but you don't know exactly where the answer is coming from. So kind of some unique kind of risks and challenges in AI that we want to kind of evolve as, frankly, our vendors evolving, right, and learning kind of the risks inherent in this kind of powerful tool.
Yeah, gosh, that sounds really familiar to what we're experiencing even here at Clearwater. So
Sure.
it's great to hear your perspective on that. Blaine, this one's for you. How has AI changed the way your team evaluates new technology risk?
Well, I think we really just added another vertical to our business structure, correct? And so, we've had to, in concert with the AI committee, we've had to come up with a litany of questionnaires, if I can put it that way, of how we're going to vet any type of third party vendor that's coming into our environment. And number one, it really starts at the contract language that I think Chris was alluding to. You really need to take a look at the fine print on the contract mechanism that's going through your organization. And if you do find that there's AI verbiage in there, you really need to dig down deep. And for me, that's really having a good relationship with compliance risk and general counsel to say, hey guys, we may need to take a look at this to see, number one, how are they, harvesting our information for their gain? How are they using it? Do we have the BA, things of that nature in place to limit our risk, or at least put our risk in a container? But for my role as a CISO, it just trickles down to my team that now we need to have yet another look at something that we may not totally understand, because it's so new to our vertical, especially my CISO team members, because we have different stages of maturity. So it's really presented an opportunity for us to take a step back and really ascertain, do we really know what we're looking at? And if not, let's take our time just a little bit longer, have a good look. And if we really don't have the answers, then go back to the vendor to solicit the answers to those tough questions that we need to ask. And then we put it in a scoring matrix. Is this something that we want to go down? And I tell my team that, we need to be in the habit of how can we say yes for the enterprise if it's one going to impact patient safety or it's going to improve patient care. And number two, is it something that's good for our business vertical? And so we want to always say yes if we possibly can. And so you really, at my advise and assist role, I present that risk score and a recommendation to the senior leaders and say, hey, we think we can move out with these controls in place. But I think it's really just solidified once again the partnerships between compliance, risk, privacy, and general counsel to make sure that we're doing the right thing for the organization. And where are you at in your maturity? How's it fit in your IT stack? Is it integrated with Epic or Cerner? Those types of questions that we really need to be focused on.
Yeah, I think it's a great comment you made around, trying to enable the organization and not being the bad guy. I just remember in my journey throughout security, we've always been, the bad guy. And so how do
Yeah,
you
the people
really
that
get
say
away
no
from
all the
that?
time, right?
That's right.
Yeah,
Yeah, no,
yeah.
yeah. So
Flip that paradigm.
that's right. Yeah, appreciate that. So this is for both of you. Chris, I'll have you go first. 85% of the organizations report unclear AI ownership. What does that ambiguity look like from where you sit?
Sure. Yeah, and I mean, I think part of that kind of lack of ownership, or I've heard like the accountability vacuum, right? Where it's like, you know, the technology's just grown at such a rapid pace, and people are just trying to keep up, but then they think they get, back to square one, and then it's pushed forward again. So it's an ever-changing landscape, and adapting is an ongoing challenge. But in terms of accountability, it's kind of identifying that there's going to be unique AI issues, but there's also going to be regular business process issues that now have an AI component attached to it. So I think and again, every company, including ours, is trying to evaluate what are the use cases, and from a business perspective, what are the current use cases with a positive ROI, right? I mean, there's a
Mhm.
lot of use cases that 2 years from now might be very promising and have an ROI, but right now, it's a lot of experimentation. You hear these stories of, you reach your token cap, and then all of a sudden, if you don't have kind of a ceiling on it, it can get crazy. Or we had a budget, had to ask for the company card to kind of get more authorization because he's finding some use cases, but then it's like at what cost, right? And you hear stories of you know there's been some maybe workforce kind of reduction, but then you reduce 10 people, but then that saves you X, but then you're spending 30X on token count. So is that kind of feasible? So it's finding the use cases and then adapting it to your current infrastructure. Big one that we're using, is, for our RCM, optimizing, revenue cycle, but at the same time catching errors, catching missing documentation and opportunities, providing feedback to our providers so that they can kind of improve on an ongoing basis. But in that example of RCM optimization, right, you don't want to be an early adopter where it's you're so ahead of the curve and your spend rate on AI is kind of going parabolic. But at the same time, it's important to kind of understand that we're the providers, we're in the provider space. The insurers on the other side are using this kind of against us, right, for lack of a better term. So you want to do not fall too far behind either, and be able to kind of use those tools like to kind of prevent denials, things like that. So it's about finding kind of, and the same thing with governance, right? You embed it into your current, at some point, right? Our company currently doesn't have an AI committee. We do have an IT steering committee that, the agenda on AI is becoming a larger percentage over time. We have a quarterly compliance committee that we're starting to talk about, AI policies, AI procedures, what are, kind of accepted and unaccepted use cases, what are the kind of approval protocols for new use cases, and then escalation, right? Like if something does go wrong, right, who needs to be notified, the timelines, and kind of working through those dynamics. So, we're figuring out just like every other company is, but I think kind of staying abreast of kind of what's new and emerging, and trying to your best to stay kind of on that level so you're not excessively reactive and you have some proactive kind of safeguards in place.
Absolutely. Blaine, what's your take on that? What does the ambiguity look like from where you sit?
I think it's twofold. One, in my role, I need to make sure that if an AI project is coming into our environment, that you know we have procedures in place for our IT intake, and that goes through a review committee to say yes, this is good for the enterprise, and we should roll this out. And it gets put on the project scope list, right? And then it gets vetted by my team. It gets vetted by applications team and the architects and what have you. Then all of that's going to roll up to the CIO and the executive team, right? And some type of report out. I think the question to ask at the end of the day is who owns enterprise risk?
Mm.
A lot of fingers can be pointed. Well, you're the co-chair for the AI subcommittee, but I don't own risk as a CISO for the organization. Leadership does. Yes, I'm part of the C-suite, but not at the executive level. So I'm there to provide input and recommendations. We've got risk on rev cycle, clinical side, contracting, you name it. And all of those they comprise the enterprise risk structure. And all of that's going to eventually probably roll up to the CEO or the COO of the organization. So, you can produce a RACI and people can say, look, yeah, I've got their name is there, but when things go upside down, and things have to happen, I guess that's when you really find out who's going to be leading, who's going to take charge. I think to remember too that if an AI project comes across your desk, there's going to be a champion, and that product could come from supply chain, it can come from HIM reps, wherever the case may be, and those people are going to have to toot their horn of why this is good for the enterprise, and then it'll go through the whole entire governance piece. So you'll get a couple of set of eyes looking at everything, but at the end of the day, if things to go really wrong for the enterprise, I think it's still going to have to go back to the executive leadership team, because they're going to be accepting risk at that level for the entire enterprise.
Hmm. I feel like that was a little of a spoiler alert to the answer here. We'll see how it goes. So my next question for both of you is who owns third-party AI vendor risk, and how is that different from your existing vendor management process? Blaine, I'll start with you.
I don't, in some ways, I don't view it as being any different than the way we vet our other TPRM, third party risk management, models. Um, you just have to be, you just need to be smart in AI and ensure that you're asking the right questions. And, when we first started our journey, I felt so out of water, if I can put it that, Chris. It was
Mhm.
there were so many things that I didn't know, and I was struggling to find out what should we do, how should we be doing it, is this the right thing to do? And a lot of people that I've spoken to in healthcare, they were in the same boat. The gates were open and the horses took off, and they were running the AI race, and there were not a lot of guardrails and governance structure that were put in place. And so, in my instance, we've actually paused and come back to the beginning stages and relooking at all of that stuff all over again to ensure that we're not missing any critical things as part of our AI portfolio. But back to your original question, we vet it. We provide recommendation of whether we should pursue this with my CISO role. Then we provide that recommendation. At the end of the day, leadership always has the opportunity to go against what you recommend, and that's okay. It doesn't mean anything's wrong, and that's why they're in the senior leadership positions. Um, so I think back to the contracting language that I mentioned earlier, when you're vetting those third parties and they're using AI tools, you need to be asking questions about hallucination, same things that Chris was bringing up, and how they're responsible, particularly if it could potentially impact patient care, ambience, whatever the case may be. You really need to be looking at stuff. And then with the contracting mechanism, ensuring that your general counsel and privacy are looking at those language models inside the contract mechanism to ensure that the organization is protected as best as you know how.
Yeah, makes sense. Chris, what about you? What's your thought on who owns the third-party AI vendor risk, and how is it different from your existing vendor management process?
Sure. Yeah, I mean, like Blaine, like we don't really handle kind of third-party AI vendor risk any differently, other than maybe, a little bit more, IT, myself, kind of other people that maybe have the AI kind of background, kind of more at the front and more kind of leaning on our opinions. And maybe an extra session. Like what we've done is, some vendors, we've had net new AI vendors that we've kind of had, different kind of negotiations or discussions. We usually add like an extra maybe session, like kind of like this, like a virtual session where we can kick the tires and kind of ask like the relevant questions. Um, and again, like Blaine mentioned, like, there's going to be kind of, you know, different stakeholders that are going to want to push, including executive team for certain maybe AI solutions. But, I think having a cross-disciplinary team where, everybody kind of is able to give their perspective and really provide as much information. So you're making, again, in AI world, you don't know what's coming 6 months, a year from now, but you want to make as an informed decision as you can with this information you have at current moment. So really kind of just generic vendor risk plus maybe a couple extra questions or diligence inquiries at the beginning. From my perspective, asking about the privacy implications, the data, like, how is it being maintained? Maybe looking to add a few things to our template business associate agreement to talk about kind of like what's going to be in an LLM, what's going to be precluded from an LLM, kind of things like that. So it's really just kind of standard vendor risk plus a couple extra, you know, keep the vendor honest questions, so to speak.
Yeah. Yeah, that makes sense. Yeah, all those questions. Where's my data going? Is it staying in my own environment and model? Yeah, totally
Sure.
agree there. So moving into more of building the accountability model, Blaine, does your organization have a formal AI governance structure today? Walk us through what that looks like.
So we initially stood up a charter in our organization, created AI policy, created an AI subcommittee, uh, like I mentioned previously, that comprised of several different people from different areas of the hospital. Um, in retrospect, we went back, looked at it, decided that it wasn't quite robust enough. And so we're modifying that to include more members from the enterprise to have different, you know, different eyes, different thoughts from every time we look at um, any type of AI product that's getting ready to come into our environment. Um, the ability to be able to have a diverse set of eyes look at everything, I think, is important. To ask questions that you perhaps would never even think to ask uh, is important. But then once again, the AI subcommittee is really only there to take a look and said this should this be a good fit for our organization or not. And then let's not forget that the champion who's leading the effort to bring that AI model, whatever the case, is there, pleading their case to say this is why the business justification of why we would need this. So I think to have a just a robust checks and balances in place to make sure that you're hitting the things that you need to hit. Um, and converse to that is you need to be knowledgeable to ensure that you're asking the right questions. And I think at first when we kicked off, we were just we had a lot of people that coming to us. We wanted to use this, wanted to use that, and we were just really behind the power curve. Didn't know how we should proceed, what type of question we should be asking, and what are the things that we should and should not be looking at. I think in the last 18 months we've come quite a long ways to be able to take a look and said, well, this is an indicator. This is probably in the contract language, and so we're really just taking a deeper look. Um, and last point I'd like to mention is this space is moving so quickly. There are people coming into the market each and every day. And I'm sure that there are some products and companies that hit the market 2 years ago that are no longer in business. At the end of another 6 years, you're going to have your top, whatever, 10 people, companies that's going to be leading the pack, particularly in healthcare. So I think at this, I wouldn't call it we're the beta version or beta step of AI, but we really are in a lot of cases. We really took the stance of let's proceed cautiously just because we didn't know a lot of things and perhaps let some other people make mistakes first and then learn from those. Um, but we have made some good decisions with some good people coming to the table with some good thoughts and realizing that people at the table had the ability to say no. And if they said no, let's listen to the rationale why they're saying no, why we shouldn't do that. So hope that answers the question.
Yeah, no, that's great. It kind of reminds me of our approach too. We've got a little bit of the gas of people that want to bring things to the table, and then the brakes. I actually run the brakes team, so the governance side of it. So yeah, so which is kind of hard for me because I think it's really interesting with AI and all the things that we can do. But we gotta ask the hard questions too. So yeah, I get that. Makes total sense to me. So Chris, where do your roles between you two genuinely overlap? Like where do they really divide?
Sure. I mean, shameless plug, but for our company, it's at our every other Friday Clearwater compliance session in Friday mornings. So myself and our chief information officer, we meet, we go through kind of like our work plan. We have a lot of different initiatives, right? Risk management, business impact analysis, our annual privacy assessments, pin testing, all these different kind of things that we work together, both from IT security and now kind of like IT security plus AI, and looking at kind of the different risks and vulnerabilities that are kind of emerging, things that, maybe we weren't talking about a year or two from now, but now it's kind of come to our attention and, front and center. It needs to be kind of looked at more with a kind of a fine-tooth comb. So there's definitely a lot of overlap between compliance and chief information officers and just kind of our greater IT security team. We have a great applications team. We have great kind of infrastructure, hardware, kind of subject matter experts, and really kind of, you know, I learned so much from them. I hope they learn a little bit from me, but asking different questions and being a part of different meetings. Obviously, there is some division, right, in terms of like things that they're asking, things that maybe they've been trained on, generally more technical in nature, right? Some things that, I sit on these meetings and, I understand big picture what they're talking about, but they can get in the weeds and start getting more technical in terms of like the IT security components and kind of the safeguards. I speak the language, but I'm not completely fluent, but work in progress. But the same thing on my end, right? There's certain things that kind of based on my experience working at previous health systems and kind of current things that have come to my attention in my compliance role, through our hotline or just, executive, people reaching out. I have a different perspective and maybe can ask some important salient questions that kind of aren't covered in the more technical component. So looking at the privacy risks, right? Do we need to kind of look at, a BAA or enhancing a BAA, non-disclosure when it's appropriate? What are the contract terms? What are our terms? What are our out provisions? Again, when it's moving so fast, right? A standard 2-year contract might be too excessive, right? Because, for a lot of other vendors, 2 years with maybe a year renewal is standard. But for these agreements, maybe we do 2 years, but there's got to be certain provisions where it's like, we have maybe some wiggle room or some outs. If this, 18 months from now is no longer, the vendor that's kind of on the same page with us or kind of aligns with our, kind of overall kind of corporate objectives. So, there's definitely some divide, but I look at it as a positive, right? There's different kind of perspectives to see at the same issue. We can ask different questions. We can analyze different risks. And we can learn from each other and kind of grow in that process. So I really appreciate like the IT and information team that I work with, and it's a pleasure to kind of collaborate and kind of learn from others.
Yeah. That's a really good point about the contract length. That's actually something I hadn't thought about before. But with AI, I think, yeah, that's especially important. And any tools that have that, maybe they're not relevant in 6 months or a year, and you're stuck in this contract. Interesting. So you
Sure.
mentioned a lot of like other players that are at the table around AI. What about like legal, internal audit, maybe clinical leadership? How do they kind of fit into all this?
Sure. Yeah. And again, there's so many different use cases currently and new cases that are emerging. And again, like you mentioned, right, uh, you know, some industry players are moving ahead of others, and there's also what I see in the AI space is a lot of diversification, right? Right. I mean, it's just like OpenAI, ChatGPT, and now Anthropic, and kind of like maybe they're in the horse race, but now there's all these kind of like ancillary companies that they're kind of creating their own niche, and also kind of subdividing and creating their own healthcare niche, right? To address specific healthcare needs like revenue cycle management, like you know, budgeting, accounting, finance for kind of small, medium, and large size healthcare enterprises that have kind of unique business models in the sector. So, in terms of who needs to be at the table, I think you need to have a cross-functional representation because, like I said, there's so many different implications to the AI technology. It's going to transform certain kind of processes within your health system or healthcare organization. So, people that come to mind are, clinical informatics, people that kind of know the IT language, but also, nursing staff, things, people that have that kind of hybrid background that can understand the clinical applications, but also kind of, speak the IT language and kind of bridge that gap there. Some companies have data scientists, definitely compliance, shameless plug, legal. Also, in healthcare, you want to have people that are going to look at the patient advocacy component of this, right? There's privacy rights, there's potential, you know, the patient interaction, right? How you, interact with people at different levels of their care process. So having clinicians, right? We're a physician-led organization, so having our senior physicians have a seat at the table, but just different kind of uh, it's going to impact so many different people in the organization. You want to have representation from all those different subject matter expertise to kind of analyze it from the different perspectives and make sure that obviously we're putting patient care priority, but we're also looking at right sustainable business models and that are both financially and kind of ethically sustainable. And then I look at kind of separation of oversight. Again, a lot of these, you know, AI enhancements, they're sometimes driven by finance and the financial potential benefits or boons to potential, ROI or margins. However, you need to have kind of special oversight just dedicated to focus on the risk component, on the safety and ethical components of the kind of things that you're going to kind of implement. Again, sometimes, you have a budget and you got to stick to it. But I mean, how do we work with that in a way that's kind of safe and efficient and kind of not creating, unnecessary risks to the organization? And then I would say like the final thing is, you're going to have all these people at the table, but who makes the decisions? Who makes the kind of final risk determinations? Obviously, generally it's the CEO or the board, but you want them to have all the information, right? What are the risks that we can, have a certain level of risk tolerance for? What are the risks that are kind of non-negotiable? And is there a way to, again, we want to get to yes, but is there a way we can get those non-negotiable risks either, to be third-partied, to be mitigated as best we possible, or using maybe our internal infrastructure to turn them from non-negotiable to kind of something more within our risk tolerance based on taking some kind of best practices given the circumstances. So I think those are kind of the big things, but definitely you want to have a cross-disciplinary team at the table, just given all the implications.
Yeah. Okay. Makes sense. It kind of aligns with some of the things that Blaine was talking about too. So question for you both here. So with some of the folks on the phone, what is the minimum viable accountability model for a mid-size health system that can't hire its way out of a problem?
I would
So
say,
Blaine, yeah.
yeah, I would definitely establish a charter, have your AI policy, and then an AI subcommittee. And the subcommittee needs to report up to someone in authority that is going to be able to delegate authority down to that AI subcommittee to recommend a yes or no to the organization. Because you don't want to be wasting your time. Everybody's so busy. The calendars there's no white space left on the calendars. So I think for those small, and if you don't even have enough PD, you need people for a subcommittee, have enough people for a quorum, um, and that are legitimately wanting to be on that subcommittee. Because sometimes it's just very cumbersome. It's not fun. There's a lot of things that you really don't understand. And then the things that you don't understand, if they're going to impact parts of the clinic, perhaps, then, reach out to those people, your partners inside the organization, to allow them to sit in ad hoc on those subcommittee meetings. Uh, because why not? You really need as much information as you can to make a viable decision of how we would like to move forward. And number two is you, you're going to have to be familiar with your organization's risk appetite. And Chris mentioned the risk tolerance levels. And really, though, a lot of times those are not pushed down to, maybe VP or director levels because they sometimes sit up a little bit higher. Um, and in your scoring matrix, you need to have at least some type of pseudo scoring matrix to say, these are the things that we thought about. This is the risk. This is how we scored it. And if it rates, 7 out of 10, then it's a go. And if it's a 3 out of 10, whatever the case may be, then it's a recommendation of a no go. So I think having some type of small governance model in place that's formalized, that's recognized, would probably be the easiest thing out the gate. And then just don't be afraid to escalate if you think that it's out of your wheelhouse or it's taking on too much than that subcommittee can handle. Then simply raise your hand and start asking some hard questions.
I feel like that's a really consumable way to explain that. Thank you. Chris, what's your view on that?
Yeah, I mean, it's not going to be a one size fits all approach, right? I mean, in healthcare, you have kind of small, medium, and large organizations, right? I've worked at kind of a mix throughout my career. So it's like, if you work at a large health system like an HCA or a Tenet, and you can throw kind of, you know, close to unlimited resources at certain problems, you're at kind of one end of the spectrum, but there's a lot of, smaller, mid-size practices that, there's resource constraints and, the budget is tight. Margins aren't maybe the same as pre-COVID levels. And you got to make do with kind of the resources you have. So there's a lot of ways you can kind of, instead of hiring kind of a, you know, an, you kind of changing your business model and going kind of tech heavy and hiring a bunch of people that kind of speak the AI language or know the kind of the operational risk that it presents. There's ways you can be creative, like at our company, right? One thing we always ask, right, when we're looking at budget and net new employees, it's like, do we need W-2s? Do we need 1099s, right? Is this a long-term problem, right? Is this something that maybe we need resources for the next 90 days, but maybe not for the next 9 years, right? So kind of looking at what are the resource needs. Can we hire independent contractors, short-term kind of like solutions? I think, one thing that's been talked about a lot in AI is you know, kind of the fear mongering, the job displacement, right? I'm kind of more of an AI optimist. I think there's going to be so many more use cases, so many more opportunities, and it's going to kind of evolve. But kind of a newer sector that is kind of emerging is like AI consultancy, right? Like people that especially in healthcare, right? Like our kind of bread and butter primary business model is treating patients and treating their specialized needs and conditions through physician assessment. And we're not the subject matter expert in everything, but we can hire or bring on maybe consultants for on a short-term basis that can kind of help us evaluate the risks, helps us make the best decisions. And again, if we're going through that like in a pre-contracting process, we might not need them for more than 30 to 90 days, right? So we can't maybe hire an army like a large size health system can, but we can kind of short term kind of say, hey, this is a risk that we can't just kind of like close our eyes and throw the dart at the dartboard. Like we need to kind of exhaust some resources, but we'll be smart and mindful on kind of what that resource allocation represents, and look for kind of like leveraging third parties or kind of short-term support, to help us kind of navigate the solution and then, kind of see how it plays out and then kind of, take it, month by month, quarter by quarter.
Well, if you want to spend more time with Clearwater, we can do that too. So, shameless plug. Uh, all right. So, I would like to move towards practical guidance for the audience that is here, and what can they act on before the next session that hopefully they'll be at. So, both of you, Blade, let's start with you. What's one big thing you wish you'd put in place sooner?
The governance structure.
Yeah.
Don't, regardless of how robust you think it needs to be, get with some smart people, whether they're inside your organization or not, and start putting the guardrails in place. Um, number one. Number two, part of the guardrails to be is that there's going to be a lot of products. If, as an example, if you haven't taken the launch out the gate, there's going to be a lot of people wanting to use a lot of different products. And so go through an intake process, vet those, and take your time doing them unless it's a priority project coming from senior leadership that says this has to be done within the next 90 to 180 days. Don't be afraid to put the brakes on for some of those things that perhaps is low hanging fruit, but that the ROI might not be as big as front. And don't get me wrong, but AI is here to stay. There's so much good and efficiencies within healthcare that this can be used. But it's like anything else. We say this often, it's the shiny thing right now. And sometimes the shiny thing is a very good thing, but sometimes it can be a huge distractor. And we want to push it forward without really doing our due diligence. So that would be number three. Just stick to the due diligence that you need, that you need to do. Get the right people on the team that can make some thoughtful decisions, and then have an advocate on the senior leadership table that can escalate, because things are going to have to be escalated sooner or later. And so put those things in place and ensure you have the right people in the mix, as was mentioned earlier: compliance, privacy, general counsel, you know, prudent team members from across the organization that can lend their voice, their expertise from their business verticals, that will assist you in just asking the right type of questions.
Great.
Yeah.
What
And
about you, Chris?
I'll agree with Blaine in terms of like, I wish I could kind of put like governance, or we could have spoken about governance more in kind of a earlier stage. Also, I would add to that, like, we created like AI policies, and I wish we'd put those in place, right? Because again, you get these questions from these different markets and these providers. I want this AI scribe or this new AI tool or this RCM function, IT function, and there was times where it's like, oh, well, what's your policy on this? And it's like, well, coming up next quarter, right? Like to be honest, we hadn't kind of thought through kind of policy implications and kind of what was coming next, and kind of just trying to be ahead of the curve as opposed to just reacting to the next thing that AI. But I mean, totally agree with Lane. Like AI is here to stay. It's not going anywhere. On a personal level, right? I wish like I'm very diligent now about kind of, literature and kind of staying informed on kind of what's happening across the AI landscape. But 2 years ago, maybe not so much. I heard about it, people were talking about it, but I was just like, oh, IT, they got that under control. Right? But it's like, you can't have that mindset. It's going to impact everybody. It's going to impact all departments. And I think the final thing is kind of like, kind of how you communicate it, and like the tone you use, like with other kind of stakeholders throughout the organization, kind of understanding that implication. Because, at the end of the day, like all these AI tools, the baseline is to drive efficiencies, right? And to kind of, get people to like automated, get things to be automated, lower level work so people can do kind of higher order activities. So, ultimately it's to make jobs simpler, right? So sometimes you get caught up in these discussions and kind of discussing these risks, but it's like, you know, let's get back to kind of like first principles. Like we're here to drive efficiencies through this process, right? So if we're not driving efficiencies, or we feel like this is causing too much consternation about risk tolerance, and kind of conversations maybe that, we don't want to have right now. Let's, not let's kind of not lose focus of what's kind of our primary driver. Let's get more, kind of patient centric, patient focused. So again, you could get bogged down in kind of like, the shiny toy, the newness of AI, but ultimately, if it's not making your life simpler, more efficient, more streamlined, like I think about my old law school professor. Freedom of contract is freedom from contract, right? If we don't need an AI contract, if we don't need an AI tool, like let's just walk away. Let's find another battle, because there's plenty other fires to put out across the organization.
Yeah, yeah, and the efficiency piece, yeah, that really resonates. I mean, my own primary care doctor has a sign up in his office that says, using AI to help with charting or whatever. And he can spend more time with me and talking to me versus like having to take all these notes on the things that I'm saying. And yeah, I think efficiency and more paying more attention to the patient in those situations is a huge opportunity. So really
And a lot
resonates.
of states are requiring that disclosure that you
Oh,
referenced, right?
yeah.
Like
Yeah.
you have to disclose, like we use AI,
Mhm.
these are the use cases.
Yeah.
So yeah, I mean, I mean, we haven't even kind of touched the surface on like the ever evolving like regulatory landscape, and is preemption coming to kind of AI in healthcare? So
Mhm.
yeah, that's like a whole nother can of worms, so to speak.
We can do that on the next session. Um, all right. So the next question here is, what's the first internal conversation a CISO or a CCO should start if AI governance is still undefined? Chris, you want to
That,
take that first, or Blaine?
that's a really good question. Um, who owns it? And, it's the title of our session today. And that who's got this? Who's taking a look at it? And, a lot of people would point their finger right back to IT, right? It's an application. It's residing on this. It's run a database. It has Epic integration, whatever the case may be. And so it should live in IT. Wherever that decision is, there needs to be a deciding factor. Somebody needs to own it, and that's going to be up to the leadership team to decide. I wasn't happy when I got it, but at the end of the day, was I in a position to? It depends on who you talk to, and which day you talk to them about who would want it. But at the end of the day, it's here to stay, and it needs to be addressed. I get my sleeves rolled up a lot with this more right now with the project intake for AI and the auditing piece for shadow AI. We haven't talked about that in this session yet, but some of the things that we need to be doing. And for the CISOs out there, you're probably already doing this, but you you can shake your head knowing that you've got shadow AI in use today. And hopefully you've got guardrails in place to prevent PII, proprietary confidential information from being uploaded to Anthropic, Claude, Chat, whatever the case may be. If you're not doing that, then I would highly recommend that you go take a look at that because people do what they do. And if you don't have Copilot, BA, whatever the case may be there, then you need to be able to give people a viable option. Because if not, they're going to do the workaround. And so that was one of the precursors for us is we need to put something in place because we know people are going to use it. Not a good answer, maybe, Kirsty, for your question, but you need a place to start. Designate somebody, and I would not, it would not just be one, but at least 2 or 3 people to say, hey, can you guys lead this for us? And start from there. And if they don't have the requisite knowledge, then there's a lot of resources you can reach out. NIST has a document. Chime has a lot of stuff. So there's a lot of resources on the open internet.
Yeah, no, that was perfect, Blaine. I mean, I'm glad that you mentioned the shadow AI piece because, yeah, we haven't talked about that, and it is definitely happening. That's just human nature. If you don't have an option, you're going to find an option. It's just kind of how we work as humans. So Chris, how about you? What's the first internal conversation a CISO or CCO should start if AI governance is still undefined?
Yeah, it's a good question. I mean, I think for me, it's like, what is our current baseline state? And then what is the state that we want to get to? And then how do we bridge that gap? And again, there's, you know, from a governance perspective, right? Like who needs to be at the table, who needs to opine on certain risks. And I think, accountability is so key. Like who's going to own this project, right? Like, who is the operational leader who's brought this AI tool or kind of is championing this and making them kind of an important part of that discussion. Another concept we haven't discussed is the confirmation bias of AI. So another thing we're talking about is kind of getting people to understand, providing general education to our staff on prompting and how to kind of use AI to kind of your benefits, right? I see you joke like AI is kind of like a politician, like, it'll tell you what you want to hear sometimes. So the way you prompt, the way you ask questions, I mean, there's a whole kind of like, thought process, game theory kind of like application to that. So it's kind of finding that initial state and then how do we get to that next state? And again, it's going to be an ever moving target, right? Because AI is going to continue to adapt and our needs with AI and our vendors who provide AI services is going to continue to adapt. So I think that's the baseline conversation that we start with and then we grow from there.
Right.
Well, thank you guys so much for that practical advice for our audience. We are moving into our Q&A now, and we do have a question from Gary Sparks. Blaine, this first one is for you. Are you allowing affiliated providers to use their own AI tools like ambient listening transcription when in your facilities, or must they use an OnVita solution?
Yeah, we're going to sway away from independent people using their own tools within the confines of our enterprise structure, unless there would be some type of prior agreement that would have to be levied through general counsel and privacy on that.
Okay, great. And then the next one is for both you, Blaine and Chris. How do you handle the evolution of tools from third parties that introduce AI components after the agreement has been signed? How are you made aware of the new functionality, and does it trigger a new third-party risk assessment?
Great question. Scope creep right after the contract has been signed, or scope creep while the contract is in process, waiting for wet signature to be affixed. Welcome to our nightmare, right? So it's, you would hope that it's not going to happen. And then, scenario number 2, you've signed the contract, it's a year down the road, and now that third party vendor has introduced AI into their processing or their platform. One, you hope that you get notified. If they notify you, then yes, I would seek an addendum to the third party risk assessment and have them complete a new one and then attest to what they're doing. And then also, relook at the contract language to find out if they were supposed to notify us of that change to the initial contract. So, I think TPRM, third party risk management for our vendors right now is a really big opportunity for healthcare. Normal size hospitals have hundreds, big size hospitals have thousands of external partners that they use. And most often the assessment is done pre-contract and then normally upon contract renewal or renewal of the BAA. I think we could pay attention there a little bit more in healthcare on that. It's an ongoing process. There's a lot of good vendors out there that can help with that, but I still think that's a large opportunity for healthcare.
Sure.
So,
Yeah, I think it's a really great question. And scope creep is like a real thing. Like all these, kind of third party vendors, they have, their revenue expectations and they feel like, well, we can, throw in an AI tool and, sell it as like, you're going from, a Chevy to a Cadillac and but we're going to charge like a Lamborghini price. And so they're always going to try to sell you on kind of the new and latest and greatest. And again, sometimes it might align, right? And again, you go through kind of negotiating pricing and kind of functionality. But it's definitely something to keep in mind. I see it, in our day-to-day kind of contracting process, right? The price is X, but we rebranded it as service with AI or like embed AI in the name or something. And all of a sudden, like it's like X times 50% or something like that for basically the same tool with like, kind of a very kind of not so great bot or something like that, like embedded. So it's something you really want to kind of put at the forefront, regardless of the size of your organization, right? Make sure that you're continue evaluating, is this in our ongoing business interests? And what's needs versus wants, right? Because wants are infinite, needs are kind of more kind of realistic and tie you more to your budget objectives.
awesome. Thank you. I think we have quickly time for one more question that came in. How are you managing emerging search engine AI tools like Google Gemini?
We have not gone down that road yet.
Yeah, I mean, it's a great question. There's so many ways you could. I mean, like at some point, everyone's got I'm aging myself, but everybody's got a supercomputer on their phone, right? Like people are going to use what they use. Like we're not here to regulate private conduct, but when you're using kind of like our IT infrastructure, we got to kind of drive people to, our acceptable, approved use cases, right? Again, I look at it from like a contract perspective, like, we've spent good money to kind of get acceptable use cases and kind of, go through the diligence, mitigate the risks, and kind of steer our team members throughout the organization to kind of these tools that are going to help them and support them in their job functions. But we can't people, I mean, the big thing you see is like we can't have people doing like ex parte agreements or kind of like, go circumventing like our kind of procurement and contracting process. Again, we try to use our scale to kind of get economies of scale, get better pricing, get better service. And we only do that if we operate as one organization, not as kind of like 20 different market silos. So kind of, using this technology to the best of our advantage.
Awesome. Well, I want to thank you, Chris, Blaine, and Chrissy so much for your time today in this discussion. We really appreciate it. Before we wrap up, I'd like to give everyone a quick preview of what's coming next in our AI summer series. So on July 1st, we'll explore agentic AI in healthcare, navigating regulatory uncertainty and building governance that lasts. So as AI systems become increasingly autonomous, healthcare organizations face new questions around accountability, oversight, and compliance. So Clearwater's Don Morgenstern will be joined by healthcare attorney Adam Green to discuss the evolving regulatory landscape and practical governance strategies organizations can implement today. Then on July 8th, we'll shift our focus to cybersecurity with a session titled When the Attackers Bring AI 2026 Healthcare Threats in Plain View. So, this panel of security leaders and practitioners will examine how threat actors are leveraging AI from advanced phishing and voice cloning attacks to vulnerabilities in AI-enabled technologies and what healthcare organizations should prioritize to defend against them. Then on July 15th, we'll move from strategy to execution in the session From Commitment to Execution, Operationalizing AI Governance in Healthcare, where our Dave Bailey and Kate Ciclone from Guidehouse will discuss what it takes to build effective governance programs, manage AI inventories, prioritize risk, and turn on AI governance from concept into an operational reality. Then we'll end our series on July 22nd with a state of AI in healthcare, where the industry really is. Clearwater's President Baxter Lee will sit down with Brenton Hill from the Coalition for Health AI, or CHAI, for a discussion on trustworthy AI, emerging governance frameworks, and what healthcare leaders should expect as AI adoption continues to mature across the industry. So we hope you'll join us for the remainder of these series. If you can't, we'll always record and make that available to you afterwards. Our time has come to an end for today. Thank you so much for spending the last hour with us, and we hope to see you again next Wednesday, same time, new topic, new speakers, but fresh perspectives. Take care, everybody. Thank you.
Thank you.
Thank you.